how do we begin to say worry or feeling a little bit frightened or like language around anxiety versus an anxiety disorder and that discernment? Because I'm also speaking like a parent as well. So, this is not just, I think it's not just me in my work, but I think language is really powerful. But there's also this fear around when a young person says they're anxious. And, it's a word that young people are hearing and they're using, and I'm hearing a lot more young people using it. But I think that distinction between, and I don't want to take away from your experience, but
Look, I would answer that by saying that there is, like I alluded to before, there is a bit of a panic about mental health experiences, that when we do experience anxiety or when we hear the word anxiety, and a similar thing is happening around, depression, my mood
mm,
is low, I'm depressed. There is this panic that comes in that we think, oh, there's a disorder here. There is something that requires medication, that requires treatment. And I'm not to say that that can't be the case. Of course, that's the whole area in which I work. But these can also be quite normal experiences and very human experiences. And, anxiety, nervousness, fear, these are very normal experiences. Now, they are hallmark experiences of certain disorders, but they exist in a normal range in and about themselves. And certainly when we're thinking about certain environments that our children are in, they're new environments. Well, new environments quite normally elicit something of an anxiety or a threat response because we don't know what it is. And if we don't know what it is, we don't know that we're going to be safe. And so there's a little bit of a just in case anxiety, that gets elicited, and that's fine, that's okay. Um, if we have to do some kind of performance, a sports performance, a speech, we know research shows us that some level of anxiety is actually performance positive, right? It gets better performances when we have that arousal. So we certainly wouldn't want to see that reduced. But then we also know that too much of that can be impairing, right? And so even in those kinds of normal ranges, if it becomes to impair our participation, our performances, well, it's something that we could probably manage a bit better and improve. But then when we're looking at anxiety disorders, it's another thing again entirely. And an anxiety disorder occurs when it is a persistent triggering of anxiety in specific situations. It's kind of predictable and habitual in that way. The response is clearly disproportionate to the trigger, and it is impairing. It gets in the way of functioning in any setting. It doesn't need to be every setting, but any setting. And obviously, we're talking today about the school setting. So, it's getting in the way of learning. It's getting in the way of a sense of belonging. It's getting in the way of building relationships.